It was a constant thing, anywhere we went, everywhere we went, there were seizures.
Aidan wouldn't have had a life in the path that he was going on. He probably wouldn't be here today.
His movements as an infant weren't just normal, typical behaviors.
The left arm didn't flail when he would get upset and cry. It would just come to his chest.
He wasn't responding, and that's when we knew that he was having his first seizure that we had caught. He was just stiff as a board, not blinking. It was really kind of a scary feeling. Many times where he would go into seizures and he would stop breathing and he would turn blue. He was popping seizures off and
15 and 20 an hour.
Yeah. We carried his medication around everywhere with us.
Really, really high doses of some of the stuff. It was, probably 2 years old before it seemed that the medicine started to kind of lose its effectiveness.
We started doing some investigating. A lot of our research came from the internet, and that's when we came across the Cleveland Clinic. He was a candidate for surgery.
I did not want somebody doing that to my little boy, and that's all there was to it. I stuck to that mindset for probably close to a year. It got to the point to where we couldn't leave Aidan alone. He was actually starting to go backwards in development. Things that he had learned, he was unlearning. We could see our son going backwards in front of our eyes, and at that point we called Dr. Gupta and we're like, look, he's getting worse. We'd like to talk about the surgery.
As soon as I laid him on the operating table, he woke up and started crying. There was nothing I could do, but it's what we had to do. So, it's what we had to do.
They were shaving Aidan's head and didn't want him to feel alone waking up bald, so we went and shaved our heads, and he loved it. We were scared when we saw all the machines and the tubes, and all that was really, really intimidating. He opened his left hand and he grabbed something, and he asked for his dad. He grabbed my hand with his left hand. Up until that point, he's never opened his left hand in his life. It was...
Yeah, when he reached out and grabbed his dad's hand with the left hand, we knew we'd done the right thing. We knew that he was gonna be okay.
It was like he was back. His personality was back.
He can go and do whatever he wants to, and he's not being held back by anything.
Wanna play with me?
He's a normal little boy now. I just came to terms that the only hug I'd get from him was his right arm wrapping around me. Now I get two-handed hugs from him every day. Tried to decide to go through the surgery, it's not easy.
I feel better.
But through that surgery, we gave our son his life. There's no more seizures. He's got that independence now.
I do good.
You're doing very well.
If the doctors out here tell you that they think the surgery can help your child in any way, they know what they're talking about. And it's the best thing you can do for your child is to listen to these people out here, because they don't just know, they care. Before coming here with Aidan, it was bleak for us. Getting my son back, it changed the world. It changed our world.
Yeah, it did.
So.
Aidan has been seizure-free since October 19, 2006.